when we were given the opportunity to approach the practices that were participating in H2O and let them know that with this project comes $1,000 towards the CHIO. The Tri-County CHIO, which includes Alfalfa, Grant, and Garfield, received $11,000. So that was a huge chunk of change. With that, the CHIO voted to actually give back to the practices that participated as a thank you, and then also to show them that the community connections there and keep their interest in CHIOs going. What was done is they formed what they call the cookie sheet, and it looked something like that, and we took it to each one of the practices, and I say we because Dawn has a practice in that territory, or the Tri-County CHIO as well, so she had a doctor that participated, and we were giving them the opportunity to choose what would be best to benefit their patients. Some of the things that we gave, and what we called them was to-go boxes, is a high blood pressure kit, which consisted of a wrist blood pressure cuff. And diabetes kit was a blood pressure cuff, blood glucose monitor, lancets, lancing device, 50 test strips. And then also there was a CHF kit, which was a blood pressure cuff, pulse ox monitor, and a scale. In addition to that, they could also use transit passes that we had printed up. And it was very, very beneficial, and the practices very welcomed all the items. They were happy to take pictures. Even the St. Mary's clinics, when I walked in after I had taken pictures and sent it to their practice administrators, those pictures were on the screens when I walked in. So it was really a good push for the CHIO and the H2O project, where they were receiving money back to the community and to their patients. Just a little thing on the Tri-County CHIO, when I asked how much money has come into that area because of the CHIO, $1,570,000 in federal funding, tax dollars coming back to Oklahoma, $30,000 in foundation funding for the 3-county economy, and then 7 new jobs plus funding for 2 support administrative personnel. So having that CHIO there was a big deal for them in that area. We also participated in the Turning Point Coalition Conference last year, and we had our CHIO conference. So we took a bulletin board of our Tri-County CHIO and some of the pictures that we had taken, just to kind of give them an idea of the impact that the Tri-County CHIO made with the H2O project. Then I also have some pictures too that I would pass around if you want to look. But the providers were, I mean, I'm sure never had anything like this before happen to them, where we gave them a sheet and said, go shopping for $1,300 on whatever you think is good for your patient. So, but this is just like some of the things that, I don't know if you can see it, but I'll pass it back. The big boxes that we took into the offices, and one man had just been diagnosed with high blood pressure, and he didn't have the funds to even get a cuff. And so they're like, we just happen to have one for you. And he's actually got the little card and started doing his home monitoring. And they said he actually cried and was very grateful for, I mean, just as simple as a blood pressure cuff. So made a big difference just having the CHIOs being involved in getting money and passing it out with H2O.
Awesome.
Yeah, very cool. Very good.
All right, next up we have Linda Bird.
Okay, so my story is going to be more on the other side, and I call it kicking and screaming, the clinics that you have to just drag along. So I had a small clinic in Hugo that I recruited after I had started working with the project. I actually worked for this clinician when I was in college, and so I knew them a little bit. Of course, it had been several years ago. But I was able to talk to them, and they joined the project just kind of based on, you know, the experience we'd already had with each other. But they really weren't sure what, you know, was going to be expected of them. It's a very small clinician-owned clinic, and So we did the enrollment went pretty well, but then we had the kickoff visit, and Cheryl had to go with Dr. Maxwell, right, for the kickoff visit. Some of the things that she told me were that she and Dr. Maxwell had to wait in their small kitchen area for a very long time while the clinician decided to see patients.
An hour and a half.
An hour and a half for that one. So also then when I started, working towards the interventions, they were very hesitant about change. Does that mean we're gonna have to do anything extra? Their EHR it's not very good to try to get any data, so we had 0 data to start with. So that's kind of what I used as something to help and kind of a way to kind of bridge the gaps. I did notice that a lot of part of the kicking and screaming came from the office manager and not the clinician. So I started, which she did not work 5 days a week. So I started making visits on days that she was not there, and it seemed to go really well. They also had hired a new nurse who had signed up with H2O with another clinic, and she was very positive and really a good change for that clinic, and so that was a good champion to find in that clinic to work with. Also doing chart audits. That to them, she had never seen where she was on any of her data before. She'd never been able to do that. So I actually did chart audits for all 4 measures, and that to me was what really kind of pulled her in, was she being able to see where she was at, And so, now then, of course, then there's setbacks. That's why I call it the kicking and screaming, because you feel pretty good, and then all of a sudden you get hit again. They decided they didn't need a second AD visit because they learned everything at the first visit, so they refused that. And at the closeout, the clinician made a comment that she knew I helped, but she really wasn't sure what I did. So, anyway, we still left with, on good terms. We still have our end of study that's scheduled, and her nurse that is the champion is already saying what other kind of projects could we participate in. So we still have some positive things that might be happening.
Good.
Thank you.
Good job.
All right, next up to center stage, we have Kathy Boo.
So this stories, when I first started recruiting them, I had formerly worked at the clinic, so I thought it was an easy task. I've been, inside the clinic. Finds out that when I started recruiting the clinic, it was a little bit challenged because I kept on communicating with the CEO. He had so much on his plate, and so he was a little bit confused what the mission was for H2O. So I called Dr. Duffy in, and then Dr. Duffy would come in and speak to him, and then he still was confused. So we went ahead and went with enrollment. We combined 2 clinics, finished it off, and then we did not meet with the clinic until a couple months later on. And then when I came back to do my first intervention, I found they actually hired a quality improvement coordinator. So he became my champion. So I started working with him closely with, the 4 measures and talking about how everything was. And not only was he just my champion for measures, but he also mentored me on quality improvement on other areas inside his clinic. So he gave me some little tips to help me, I guess, improve, because I told him this was my first time. And so he was patient. And later on, as we built our relationship, going through like the trends of my health, I found out that he had a black belt in Lean Six Sigma. And so that helped out a lot too, because he kind of gave me a better view in observing different workflows. So that one tips he does that if he wants to assign a new project to his, I guess, the staff, and so they would usually always hear them complain about getting too much projects. They don't have enough time to help them out. So what he'll do is he'll go down and observe, and he'll start conversations with some of his staff. So if they can hold a conversation with him, not work-related, more than 15 minutes, he will time it, and then he'll realize you do have time to work on certain projects. So, yeah. So that's always one thing that he would use as a QI point of view when he would go down to the clinic, because he said, I'll just wander around randomly. They can hold a conversation with him. And so that was what some of the tips that he gave me as to be a better improve practice facilitation. So that's one thing. And, we built relationships over time because he was my champ for 2 clinics. So I worked with him a lot, and he was prompt, and getting feedback, and we closed out everything on time. Didn't have difficulties. All the member surveys were completed, and then, so I enjoyed working with him. So that was the good of meeting someone working inside a clinic, because I was blind walking in, so.
All right, next up, we have Tina.
Okay, so I went to this clinic where the doctor and the nurse were horribly inappropriate with each other. I mean, I felt like every time I walked in, I was watching 50 Shades of Grey.
Oh,
Really flirting and inappropriate. And I'm sitting there just observing them. And one day they caught on and they're like, "Are you watching us?" I said, "I am." And they're like, "Do you promise you will never go tell anyone?" We're married to other people and we could get into a lot of trouble. So they will remain anonymous, but now y'all know.
Now we're gonna go look and see what clinics you have.
Give them guidance on how to do it better. That's QI. How to flirt more better.
QI or TMI.
Yeah. Woo.
So I had some good clinics. Mine was solving EMR issues. And this was the Family Healthcare and Minor Clinic. So it was one clinic, but broken into three. So 3 clinics at 2 sites. So this was one of my favorites because I spent so much time in there. But I really liked them, and we had to work on their EHR system to hopefully save them some headache and money and possibly penalties later on down the road by bringing it to their attention now. So it started off, and it wasn't the kickoff meeting, it was the facilitation meeting, but an informational meeting where we met with the whole entire staff. There was like 30 of them. And we provided them with their folders, with their reports and everything. And my PA was Jimmy, and she was awesome. So she was helping me with that. And so we had their baselines from the prior year in the first quarter. And once they looked at them, it was like some really low numbers. And they were like, okay, what's up with this? No, we're doing a lot better than this. So she wanted us to find out what was going on. So they gave us access to their system. And we began to get in there and check out, what's going on. And in total, we had 10 patients in the denominator for aspirin, but only 2 were showing up in the numerator, which of course was reflecting their poor measure. So she kept assuring us that her team were doing what they were needed to do and wanted us to look into it more. So we went through each patient individually, looking through their problem list, medical history, current medications, anything else that would indicate why they need to be in the numerator. And after going through this process for hours and weeks and, oh gosh, forever, we found out that only 1 patient from our list legitimately needed to be put on aspirin. And all the other patients didn't need to be on it or was already on it, and they just weren't shown in the numerator. So we couldn't understand what was going on, but she was relieved to know that the numbers that we presented weren't actually accurate. So she wanted us to do this for all of the other measures, which in turn turned into our intervention. So she didn't want to focus on the ABCSs at all, which also resulted in them kind of not wanting to do the CME. They did, but she felt like this was more important because it was going to help her in the long run. So, but she was also afraid that running those numbers, they would be in the cloud and it would reflect poorly. So we had to assure her that this was just for this project and it wasn't going to give them a bad grade to stay right now. But she was basically wanting to get us set up for the future. So we worked together with the EMR company to get these issues fixed and to retrieve more accurate data. And in the end, when we did get it fixed, it showed that they were doing a lot better than it reflected. So she's happy. We didn't really get much ABCS work done, but we did what we talked about earlier, what they wanted to do in the clinic. So.
Very good, yeah.
All right, next up, we have Missy McCullough.
I'm coming. So I have a 6-year-old daughter, and so I read Dr. Seuss books a lot, and I actually have the cadence of speaking like, the green eggs and ham. So because that's in my head, I went ahead and wrote about our ABCs, what it was like to be an H2OP, with the cadence of green eggs and ham. So that is what I've got for you guys today. It's true. I did like, you know, like the whole like drama stuff in school and all that. I just can't help myself sometimes. This is called Do You Know Your ABCs?
Love it.
Do you know your ABCs? I do know them. H2OP. I do know my ABCs. Do you need help here or there? I don't need help anywhere. I do know my ABCs. I do know them. H2OP. Can I get a signed consent and maybe a place to sit? Another signed consent, and there's no place for you to sit. I don't need help here or there. I don't need help anywhere. I do know my ABCs. I do know them, H2OP. Could you let me shadow and evaluate your workflow? I would not let you shadow or evaluate my workflow. I would not sign another consent, and there's still no place to sit. I do know my ABCs. I do know them, H2OP. May I access your EHR? Don't you touch that EHR. You have data for me, so you say. I should have that data now, any day, and access to my health. Just you wait. I need my data now, P. But no EHR, you let me be. I will not let you shadow or evaluate my workflow. I won't sign another consent, and there's just no place to sit. I don't need help here or there. I don't need help anywhere. I do know my ABCs. I do know them, H2OP. A survey, a survey, a survey, a survey. Would you take a survey? I would not take a survey. No more surveys, P, you let me be. Would not let you shadow or evaluate my workflow. I won't sign another consent, and there's still no place to sit. I don't need help here or there. I don't need help anywhere. I do know my ABCs. I do know them, H2OP. You do know your ABCs? I do know my ABCs. On BP, I see a first but not a second. Would you take a second? No, I could not take a second. How about enroll in another project? No, I could not enroll in another project. I will not take a second. I will not take another survey or give my patients surveys. No, you can't review a chart. Stay away from that EHR. You, H2OP, you let me be. I will not let you shadow or observe my workflow. I won't sign another consent, and there's just no place to sit. I don't need help here or there. I don't need help anywhere. I do know my ABCs. I do know them, H2OP. You do know them, so you say, but let's just try a PDSA. Try a PDSA, I say. P, if you let me be, I will try the PDSA, and you will see. Say, maybe I don't know my ABCs. But I want to, H2OP, and I'll reach my goal of 80% and sign me up for the next project. As for surveys, you say you'll pay? Well, bring on those surveys. I've got all day. Here's full access to the EHR, and also here's a Starbucks card. P, you've helped me so much, you see, so I will let you shadow and observe my workflow. I will sign informed consent, and I found a place for you to sit. I do need help here and there. Say, I need help everywhere. I'm so grateful for these ABCs. Thank you, H2OP.
No, I'm not going to sing.
Back up a little bit.
So I had a couple of clinics that were with the same organization, and one of the clinics had an awful office manager and a clinician that wanted to participate, and the other clinic had an awesome office manager and the clinicians that didn't want to participate.
Right.
So during the AD visit with the awful office manager, the office manager from the other clinic let me know that they were going to be withdrawing. And, you know, I was like, just out of the blue, didn't know. So when we finished the AD visit, Dr. Maxwell and I walked across the parking lot to go see the other clinic, the other office manager, and they told me that that the clinician would be retiring, and that they would, they just really didn't want to do it right now. One of the things that they said was that the reason they wanted to pull out was because I wasn't a nurse. So, but they would be interested in future projects. So we left on a good note. The office manager told me that if I needed any help, he would help with, he had connection with one of my other clinics, that he's still helping them, and that if I needed any help with anything, just to give him a call and he would help me. He actually helped me track down one of the clinicians for CME. I was trying to locate him so that he could complete the evaluation for well, he's a nurse practitioner, but, and so, anyways, so very helpful, and that's about it.
Great, thank you. All right, Solarke, are you ready? You are next.
So, do I have to look at that?
No, don't ignore it.
So I'm going to tell you a story about one of my providers. She's one of the most animated people that I have ever met in my life, much like Missy. So when I started working at the clinic, and everyone knows I have an unusual name, but she sort of adopted me, and she's like, oh, I don't know why, I really like you, blah, blah, blah. And she's elderly. So we go talk to the director of nursing who's over the health system. So I had 2 clinics under their health system. And the lady couldn't say my name. And she's like, let me teach you how to say her name. Her name is Paulake. Say it. And I'm like, okay, this is awkward. Step it back a bit. But anyway, I had fun working with her. Like a month or 6 weeks ago, I went in to see her because we were doing the quarterly data, and I was going over that with her. And they had dipped. They went from like 60% on blood pressure to like 24%. And I had mentioned it to her, and she got all flustered, and she wanted to know what was going on and all of that. So she asked for a visit. So I went in with the dashboard and everything. And so we started talking, and then she told me about how she was going to leave the health system because she had gotten another job in Durant. And she was like, did I tell you that I got another job? I'm like, no. She's like, sit, let me tell you what happened. And so I sat down, and she said, you know, during the interview, when they were asking me questions, I asked them whether they do QI activities, and they said no. And I got really excited because I could share everything you had taught me with them. And then next, I asked them, do you use the ASCVD risk calculator? And they were like, what's that? And I was like, well, if you give me the job, I'm going to come, put it on your phones, put it on your computers, teach you how to use it. I'm going to bring the detail aids, I'm going to train you. I'm like, goodness, I've created a monster. But she was really excited, and she was so happy that she could share all these things that she had learned from H2O with this new clinic that has absolutely nothing to do with H2O.
Nice. All right. And then our final speaker for this section is Tony.
The final contestant.
That's right, our final contestant on The Price is Right.
Yeah.
Come on
I feel
down.
like this is like the idol or whatever we call it.
Now you gotta go in between the
There you go. Can I do the weave? When Mac first asked us to do this, my thought was, wow, you know, I don't know, there's so many stories, and I didn't know where to start. But, you know, she kind of nicknamed it the good, the bad, and the ugly. And so I thought, well, I'm just going to go with that theme. But I also had a best that I wanted to tell. And the best part of this project, this is for me, may not be for everyone, was traveling the roads of Oklahoma.
Yes.
You can't see it and experience it if you don't do it. And the whole thing of riding those roads tells a story. It tells the story about the poverty. It tells the story or asks the question, how do these people get to their doctor's appointments? How does an ambulance get to them? How does that happen? Or a fire truck? So until you ride those roads, and I live in Tahlequah, which is pretty rural around us, and I had experienced some of it, but when you do it day in and day out, and you do it to 5 or 6 counties, and put, 77,000 miles on your car, brand new car in 3 years.
Yes.
And now the trunk won't lock. It's like half open out there. I don't know. That was just a side comment. But the deal was those roads for me, there were, where I'm traveling, steep hills. The kind of hills, and you know these, where you can't see the top, and when you get up there, you think you're just going to keep going up to the sky. And then you dip down like a roller coaster, and your stomach goes up in your throat. But the beautiful part about going up and going down is the views before you. And that's how you see rural America. And the seasons, we started in winter. Trees didn't have any leaves, and those craggly, ugly limbs that reach up to the sky, and I made up so many stories about those because I was driving and getting a little bored. But it also allowed me that view of the ranches, the pastures, the cattle, the people, and yes, the poverty.
Yeah.
And so as I went into spring, I cheered up a little bit because you know what? The foliage hides all that. You can't see it till you get into the clinic. Then you see the poverty and the lack of health care and the poor transportation systems. But I like spring. The trees bloom. They dress themselves in new leaves. And when you go down that hill, that's all you see is a canopy of trees. It's beautiful. And then you go into summer, my least favorite season because it affects me. And the deal is the heat. Do you remember the heat beating down into your windshield? I have no tint. Sunburning, I get there, my face was sunburned, and the physicians are like, are you okay?
Need to be seen.
I'm good, yeah, really. And I get all of my gear and walk to the door of that clinic, and the heat literally paralyzed me. I was so hot and sweating. And I'd walk in that door and the air conditioning would hit me. And I'd go back to the conference room and I'd sit down and I'd look around. It was so cold the water was freezing in my water bottle. And I froze to death. And then I walked out and that heat hit me and I drove home. If I was really lucky, I got to drive east instead of west because it was evening. And I see you shaking your head. You know what I'm talking about.
Yeah.
And then the last season's fall, my favorite. And fall is with the bright orange, yellow, red leaves on the trees.
You have such a good area though to see all that.
Yeah.
I know.
I have flat. Can I go where you?
I'm trying to help you here. Stay with me. I'm leaving. There's a position open. So what you do is you come down these hills and you see the bright colors. And as the leaves fall, you come back to the homes, the ranches, the cattle, and yes, the poverty. So this leads me into my first clinic. I go into the clinic. Everybody's friendly. They let me go back. The shadowing, whoever was talking about that shadowing. I remember Dr. Maxwell saying, data's great, it tells a story, but if you don't know the process, you're not doing your job. And so these clinics allowed me every single time I went in, I was allowed to shadow. We scheduled group meetings. We did PDSAs. We prepared for our AD visits. so that we knew what was going to happen and questions they might have for the AD. So if you went to one of these clinics, there were 7 of them, you had the opportunity as an AD to interact with these people. The other thing the clinician tells you, this made me a better practitioner. Hey, you can't get it any better than that. And the other thing is they tell you, I've taken these skills and used them for my other chronic diseases. I am applying them elsewhere. That's good. And then there's the clinic you walk into, not so good. The business manager's going to be your contact, and you're not going to be able to interact. And so you've got to figure it out, right? So you go in and you meet with her. I don't know, it seemed like a gazillion, but it wasn't. And I get workflow and a little bit about billing, and she knows nothing about the health measures. She didn't attend the AD meeting, and I'm like out of material. I can't entertain her anymore. and the next visit, I'm sitting there going, what am I going to say? Luckily, she goes, you know what, Tony? I have a meeting out here, and I'll be gone about 20 minutes. Just wait for me to get back. And I'm like, don't bother. But I didn't say it. And I can tell this story now because I'm leaving soon, so it doesn't matter. So literally, this is what I did. I sat, and I thought, you know what? She's gone. And I walked down the hall, kind of like peeking around the corner, going, ooh, there's the nurse's station. And I creep over there. Yeah, I did. I tiptoed. Hi, my name's Tony. And I start talking to them. And they're eager to converse. They're eager to share, which is what I want. You tell me your story. Clinicians would come out. We'd visit. I memorized all their names. I sneak back to the business office manager, acting as if I never left her office. The next visit, I go up to the front desk and go, hi, Susie, the nurse and I have an appointment today. We're going to get together. And she goes, oh, okay. And she escorts me back to the nurses' station where the clinicians and the nurses are. And I'm like, cool beans. We actually got some work done. Clinician allowed to let me shadow. The nurses didn't care. But I had to sneak into the business manager's office as if I had just arrived at the clinic.
Oh, wow.
And finally I got to where I walked in and I thought, what are they going to do, fire me? Call Dr. Duffy? Call Dr. Crawford? They'll give me an award for this. I got past you. So I really, and the closer you get to the end, you're a little more brazen than you were. And so this was bad. I mean, and the time it took to take this from bad to good was like a sloth climbing up a tree. And by the time you're sort of like really getting that momentum, it was closeout time.
Yeah.
So that made it bad. And then there's the third clinic. God love you. God love Dr. Duffy and his patients. The third clinic, I felt like they treated me like a dog jumping through hoops. And that's not very pretty. In fact, it's ugly. Okay? So I meet the CEO, and he just
CEO.
I said, God love you.
He now realizes what you're talking
I know
about.
where you're going.
So that's why I didn't want to share too much with my group back there, so I meet this CEO, and in fact, I had met him before I even came to work for OU. He was at Tahlequah Hospital, and now he's with an FQHC. And so I didn't actually meet him. I ran into him again, and I went, oh, okay, this is not, I'm just going to skip this clinic system. But it was 11 clinics, so I'm like, okay. So I meet him, and he just drugged me through everything. And he never said no, but he never said yes. And so I struggled with it. And then the other P came on, when you got, the other group came on. And so he and I together worked this guy. And I knew we were in trouble when he looked at me and said, "This is not a democracy." And I went, "Yo, can I come to work for you? Because it really sounds like fun." And I'm just like, oh my God, how does he have any employees? And I'm pleasant. And he goes, "Now, I'll probably just do it because I know your job depends on it." That one I couldn't get let go. I said, "No, it doesn't. No, it doesn't. I have plenty of clinics. Do it because you want to do it." He had board members saying, "Do it because it's the right thing to do." His board members were friends of mine, CHIO people I had worked with in Tahlequah. And so they backed me. He didn't budge. So it was more like call in the big guns. So I call Dr. Duffy and I go, "Yo, sir."
Yo.
And he knows when Tony goes, "Yo," it's not gonna be good. And I go, "Yo, sir, would you be willing to attend a meeting with this CEO?" I want to say his name so badly. I want you, yeah, no, I just want everybody to spread his name out there. Because there's lots of FQH people that know him. Anyway, so he agrees to attend a meeting. And I said, "You know, maybe we're not explaining it well enough. Maybe you, as a physician, he'll give you more respect, because I'm nothing but a dog jumping through a hoop." And he goes, sure, I'll come. So he comes out there, we sit down, comfortable conference room, you know. Dr. Duffy, I am ready for him to do his thing. Jump on it. He cannot turn you down. And he does his thing, and he is challenged more than once. And he does his thing, and I'm sitting there, just don't jump through hoops. Just don't jump through hoops. This story, or what? I said, just don't jump through hoops. And of course, he didn't. And I'm thinking he'll get more respect, and he did. But what he did do was promise, and promise, and promise. And the other P and I are looking at each other. Our eyes are getting bigger and bigger, and we're like, oh my God, stop, anytime now. So we go outside, and he goes, he's going to sign up. He's going to do it. And I'm like, I think you're right. I think he is. However, enrollment was a nightmare. One characteristic survey for all 11 clinics. One practice member survey for all 11 clinics. And that I went back to that. This is not a democracy. Talking about his clinics. People, this was ugly. But we managed to sneak in some practice member surveys. Couldn't do anything about the practice characteristic, but we did get all the practice member surveys done. And we had to be escorted into the clinics, or we couldn't visit them. And so your schedule depended upon the availability of his HR director, one of the busiest people in the clinic. She was as accommodating as she could be. We got half the visits in. There was absolutely no way we were going to get all of them. And so we did get through it. And at the end, they didn't do the EOS. That's ugly. So as I ride into the sunset with this H2O project in tow, I reflect on some of those experiences. And I had so many experiences that dropped into my life, new friends, beautiful travel, and just a great experience. A lot of frustrations, a lot of sadness at the poverty. But I wouldn't give it up for anything. Thanks.
Bravo.